Today, we have identified 49 new cases of COVID-19 in Alberta in the last 24 hours. This brings the total number of cases to 1,500. Of these, 713 people have recovered. This is 121 more than yesterday. We suspect 201 of our total cases may be as a result of community transmission. We have completed 2,123 COVID tests in the last 24 hours. Sadly, I must report an additional 7 deaths from COVID-19. This is the highest number of deaths we've seen in a single day. This includes 4 new deaths at the Mackenzie Town Continuing Care Facility. There have now been 17 deaths at this facility. To the family and friends of these 7 people, and to all who have recently lost loved ones to any cause, I extend my deep condolences. I know that many people are concerned about the health of residents at continuing care facilities, and I am as well. We are exploring every option to prevent illness and deaths and to keep people in continuing care facilities safe and healthy. This includes examining what other jurisdictions are doing to see where Alberta can do more. Today, in line with this analysis, we are taking new steps to prevent the spread of illness in continuing care facilities. All workers in these sites will be required to wear masks at all times when providing direct patient care or working in patient care areas within 2 meters of others. We are making this change to protect patients from inadvertent exposure from a healthcare worker who could be without symptoms but still be infectious. Continuous masking will also minimize the risk of an asymptomatic or pre-symptomatic healthcare worker exposing other workers to this illness. In addition to new masking requirements, we are requiring all workers in continuing care facilities to work at only one site. This will help prevent the spread of illness between facilities. These requirements are currently in effect at outbreak locations, but will now be required in all long-term care and supportive living sites across the province. Work is underway with the organizations that provide care in these settings to transition to this requirement, which will be implemented beginning late next week. Lodges with no supportive living designation and group home providers are encouraged to participate in this process of assigning staff to work at only one site, although at this time, for these providers, it is voluntary. We will work closely with providers of care for those living in all settings, from long-term care to group homes, to ensure that residents of these facilities continue to receive the care they need and to mitigate concerns about the supply of staff at each site. While these steps are necessary to prevent the spread of infection to and among elderly people who are at high risk of severe outcomes from this illness, they are not easy.